Mad Medicine, starring Dr. Kenneth Wright and Dahlia Ehrman. Hi, everybody. Welcome to TLA Radio, Mad Medicine, Dr. Kenneth Wright, Dahlia Ehrman. We have a great guest here today, Marc Mahoney. We have a very important subject that we're going to talk about, which is drugs, drug abuse, and drug addiction, which kind of all come together, don't they? And Dr. Wright, before we start with this subject, was there anything that you wanted to go over with us? I know every week you have a sentence or two about COVID.
Yes, we are really almost totally over this COVID pandemic, which we should celebrate. And I think it was so fun. We had a big family get together for 4th of July, and only one person out of 25 wore a mask, and it was great. It was great. And then, we're just blessed that we've come out of this, and
because we're immunized, right?
Because we're immunized, yeah. And I went and I looked at the data again. I don't see that. I don't see that the variants are really posing a problem. There are some, you can get a little sick perhaps, but, severe illness or death, it's just not happened. And I think the Israel experience, where they have a very high percentage of their population immunized, has shown that. So the variants, which flip-flop Fauci was, waving the flag. And I told you, I looked up his article, and his article actually didn't say what he said. The article he quoted, and it was an article where they took antibodies from vaccinated patients and put those antibodies against manufactured virus, and they did different viruses, the COVID-19 novel virus, and then other variants like the Delta variant. And guess what? The antibodies were effective. They did react with the virus. Now, obviously not to the extent of the COVID-19, but definitely did have an effect. And we've seen that clinically. So I think that if you're vaccinated, you can't get it, you can't give it. Okay. So you're okay. And I saw patients today who was all worried about patients who are not vaccinated.
Right. Yeah.
She was kind of perturbed with, these people that were not vaccinated. Now, I was vaccinated, but I told her, I don't care if they don't want to be vaccinated. That's on them, but you don't have to worry. You can't get it, and you can't give it, so you're okay. Okay. And there is some thought, and I told you I have doctor friends who they don't want to be immunized, and they
I've heard this more and more lately, which is interesting. Yeah. Somebody sent me overloaded me with a bunch of information on this yesterday. I'm not going to get into that, but I am going to ask you just that this morning it was on the news, so everyone saw that a 13-year-old boy died after his second immunization. Do you know anything about that?
No, I don't know about that. Okay. But that's the first death that I know about from the vaccine. And there are millions of people who've been vaccinated. Okay. But every vaccine has a risk. And so we talked about the myocarditis.
Right.
So if you're a young person, your risk of dying from COVID is so small, and now with better treatment.
Right.
So then if you're a young, healthy person, let's say you're a teenager, with the incidence of myocarditis, I don't know, there are 13 cases or something. So you got to weigh that. It's a tough decision, and I don't think people really know what's right or wrong.
Right.
But at my age, it was a no-brainer for me, and I think most people should get the vaccine.
I agree with you. We're going to move on to our subject of the day today, which is such an important one because we have such a big epidemic in America with drugs, drug abuse, and drug addiction. So, Marc, I'm going to throw it right at you.
Oh, here we go.
And you are the guest of honor today. So
thank you so much.
You could tell us your background a little bit and why I consider you an expert in this subject. The doctor and I will talk to you about it.
Well, I'm a certified drug and alcohol counselor, number one. But I and I don't have any problem saying this, in 5 days, God willing, I will be 27 years sober.
Wow,
Yeah,
amazing. That's a
so-
good one because a lot of people relapse. We'll talk
Yes.
about that soon.
And I feel like I'm different than most because I never did.
Okay,
I
that's
did this
fantastic.
once in my 20s, and I got sober, and I've stayed sober. And
That's amazing.
Thank you. And so I have 27 years of personal recovery.
Okay.
But I've been working in the field for 12 years in treatment for drugs and alcohol and dual diagnosis.
Okay.
And I've been in everything you can, every aspect you can do. I've done. I've been a residential technician, which runs the facilities.
Okay.
I've been a director of admissions, interventions, program director. I'm usually a liaison between operations and clinical.
Okay.
So I'm very heavily clinically based. I'm not a straight clinician, a therapist, or a doctor, but I'm usually the bridge between both.
Okay.
And so I've been operating the high-end luxury facilities in Malibu and the Hollywood Hills and the Valley for the last, like I said, 8 years. And currently I just opened up my own facility.
Amazing.
Yeah.
Yes.
Thank you.
Tell us the name so we know about it.
It's called Bridge to Bodhi Wellness and Therapeutic Center. It's in Studio City.
Okay, great.
And what I found with that, why I named it Wellness and Therapeutic Center, is that, I find people are too myopic. It's like either it's straight addiction or it's straight mental health, or, what I think is you have to treat the whole person.
Right.
And that's mind, body, and spirit.
Okay.
And when you treat the whole person, then they have a chance. If you just treat one aspect here and then they don't get treated for another aspect over here, that will lead to the relapse.
Okay.
So that's what I'm trying to do. I came up with my own philosophy of what I see over the years that has worked, and I'm trying to implement that now.
Well, that's great. So we were talking earlier, and I'm going to ask you about this online, is prescription drugs, which people seem to think is okay because it was prescribed by a doctor and maybe they had a little surgery or they have a back pain or a leg pain or whatever it may be. They seem to think that just because it was written by a physician, it's okay and you can't get addicted. So I'm going to have you tell us about that because I have friends and they are definitely addicted.
Well, I think there's two aspects to this.
Okay.
I think the original getting addicted to a painkiller is one issue, and that's on our pharmaceutical companies.
Okay.
That has been a huge problem. But then there's also the problem of after you've become addicted, what do you do? And so the problem when you first get it and you then try to get sober, and then it leads to relapse. So there's this cycle of in and out later. But, people just think, they don't question doctors. And no offense, Dr. Kenneth Wright. Any good doctor would tell you should question me. You should get another opinion. You should get as much information as you can and learn what's out there. And I think most of us, like if a doctor says, take this pill, myself included, I go, okay, and I take it. And then I'm like, well, what did I even take?
Right.
And so what happens is people take these pills and maybe they need it for a day or two or a week for the pain, but then they have a prescription of say 30 or 40 pills.
Yes.
And they go through that and they can get addicted on that one prescription.
Wow. It's really, and anybody can get addicted. Doctor, right?
Yeah. So I'm a surgeon, and I rarely, if ever, prescribe anything but aspirin or Tylenol and Advil. But back when I was younger, there was a congressperson's family member who died a painful death of cancer. And so they passed a bill in California where we have to take, no matter what your specialty is, if you're a licensed physician and surgeon in California, end of life education, and we have to have updated, and we have to take pain management. And what they've done is they've actually encouraged us, and some doctors have been sued for not giving enough pain medication.
Wow.
And they've encouraged us to give more, and it's very subjective, by the way, pain medications than we did, let's say, 20 years ago. We were very discouraged, and we were very aware in our training to prevent prescription drug addiction. But that actually changed in California. And we were encouraged to make sure the patient was in no pain. which is, again, this is all very subjective. So as a physician, we've been getting mixed messages.
Right.
And
doctor, is that just for the end of life, or is that across the board?
It's across the board.
Okay.
Because there's two classes that recently, maybe 10 years ago, all of a sudden we've had to have for continuing medical education, and that was the end of life course and then pain management course. Yeah. And they actually, you believe it or not, encouraged us. This was about 10 years ago when it started. They said, we're not fully medicating the patients. And it was kind of a green light for the physicians to, all right, fine, I'll give more pain meds. And I think that's part of what happened, liberalizing the amount of pain medications physicians give. And it's wrong. And there's also a lot of doctors, I think, that are, I'll put it frankly, corrupt. Right. It's easy to give the pain meds. Like, my back hurts. They give a prescription and they got to come back in a month because there's no refills, and they do it again. And so they make a fee every time the patient comes in. Now, I'm sure that's the minority, but
it is the minority. I'm with you, but it happens all the time.
It happens.
I deal with people every single day who talk to me about certain doctors that they've used and they know, and other people know. So it is out there, and that's awful. That's not the majority, though. You're right.
So what should the person do?
Let me just say that I think that we need, and it's not that hard with our computers, we need better management of narcotic drugs. We need to know what doctors are prescribing, how much are they prescribing compared to the other doctors in the same specialty. And you can see right away, you'll be able to see the outliers. And then maybe they're legit, but let's do an investigation. And I think really that really needs to be done.
It's getting a little better, doctor, because I'll tell you, I deal, with the subacute detox. So we have doctors and nurses, psychiatrists, all of it. So, and I see at times when a client say something did happen to their prescription, like an accident happened, they went down the toilet or something. It's very difficult to fill some of them now. So it's getting actually better.
Good to know.
Okay. So I'm seeing that a lot more.
Thank you for that, because I've been advocating for this myself, that I think that there's needed regulation of prescribing narcotic drugs. And I don't have that much. I'm a pediatric eye doctor, and I operate on patients with my muscle problems, and the pain's not much. But I had the sense that that's an issue.
I tell you, it's a huge issue in the industry right now for us, because there are legitimate drug addicts who might have a dual diagnosis. So they're getting sober off illegal drugs, but they're also taking, an antidepressant or a mood stabilizer or something like that. And they have been in a car accident, and they have legitimate pain all day long.
Right.
So then what do you do about that?
Okay.
For someone who's a drug addict,
What do you do?
Well,
that is the question.
There's a lot of different pain management places coming up where they're trying to do less narcotic type medications, but then also more healing, holistic healing, chiropractic work, or acupuncture, Eastern philosophies of medicine to try to help that client, and physical therapy. So, but it's a real issue, and it's a fine line we have to walk with somebody who's a drug addict who needs medication at times.
I have a question.
That's a good point. You know what we've found, and I don't know this. You think, well, aspirin's not that effective. It's pretty darn effective as an analgesic, and it's an anti-inflammatory. But if you alternate it with Tylenol,
yes,
it works very well. So that's one way we get around not having to give narcotics. So let's say you go aspirin, wait 2 hours, you go Tylenol, wait 2 hours, go aspirin. And believe it or not, it's very effective.
It is very effective. We do that at the detox centers I run.
Really?
Yes,
okay.
For sure. We do that. And, I got that from the nurses. They told me this is how you get rid of the pain.
Okay.
And I said, okay, nurses,
I'm very happy to hear you doing that, because believe it or not a lot of doctors know about it. And,
I did it. I had never heard about it. And they did. They said, Mark, this is the way to help clients and help yourself. And I was
Oh,
like, okay,
wow.
sure.
Okay.
Yeah.
That's good for me to know to tell people. Also, I have a question about the pain because I've actually heard that the more narcotics you take, the less your body can handle pain and you're actually in more pain later on. Is that true? I may be not saying it the right way.
I don't know. I mean, this might be more for the doctor on
Okay.
that, but
Mm.
I don't know, doctor. Do you
know anything about that? I've heard that the more pain pills you take, your body becomes so immune to the pain pills that you're actually in more pain.
You're talking about tolerance. But
Yeah.
tolerance.
You hit it's habituation. You actually the narcotic receptors get stimulated to such an extent that they're already stimulated, so then they need to be stimulated more. And so that's actually true, but that's part of the addiction. You need more and more to get the effect.
And what happens with a lot of these drugs that are they are naturally occurring in nature, but most of the time then they becomes a synthetic, a man-made version of it, which then of course is bastardized and they put whatever they want in it. But then also what happens is, so when it hits the receptors, say like opioid receptors, we naturally make these in our body.
Okay.
When you introduce the drug, the body stops making it.
Ah.
So it needs the drug to bring it in. So then you do more and more and more of the drug, and to get the same effect. So it is like a never-ending
circle.
Yeah.
I have a question for you, but I'm definitely know that Dr. Wright wants to mention something about it, because I know a lot of people are smoking marijuana, and it's becoming more legalized here in the United States. And people claim it's not addictive.
Yeah.
And I'm glad you're laughing. And Dr. Wright feels like you, and he's going to talk about it for a moment, and then you will.
Sure.
And I do want to know about it because so many people today think it's such a normal thing to do. It's, they come home from work and they start smoking pot, or maybe in the morning. I don't know. I'm just saying, I know it's become much more normalized in America in general, and people pretend or think that it's not addictive, and they're driving and they're doing a lot of other things while they're smoking. Sure. Go ahead, Dr. Wright. I know that you want to
go first.
Yes.
Well, guess what? It's marijuana is still, THC is still classified as a Schedule I drug.
Okay.
By the FDA.
Okay.
Now, pharmacists have Schedule I drug, 2, 3, 4 goes down in terms of addiction, of danger. You could die from over sedation. So Schedule I is the most dangerous drugs we have. You can't even prescribe them.
Okay.
The number one on the list here from the FDA is heroin. Have you heard about that?
Yes.
Heroin is a Schedule I drug. Number 2, LSD.
Okay.
You know what number 3 is from the FDA here?
No.
Cannabis, marijuana, THC is number 3. They classify it as an addictive drug.
Wow. Okay.
And it's Schedule I. Even now, even though in some states they've approved it, the federal government has not approved it.
Correct.
And through the FDA, it is classified as a Schedule I drug. I can't even prescribe it. And it is legal in California. Now, I'm going to quickly say one more thing, and then I'll shut up. And so,
no, it's all good.
One more thing is this: I was in college in the '60s, and I went to a conservative college, California Lutheran College. Now they call it California Lutheran University, but at the time it was small Lutheran school. I'm not Lutheran, but my best friend was. So I go to this school. I have 5 suite mates. All of them but one flunked out after the second, in the second semester. And you know what it was? Marijuana. That's what they started on. And they would smoke it almost every day.
Right.
I didn't know those people. So because marijuana is a fat soluble, and its metabolites go into the fat. And so the half-life, I've read a lot about half-life, and somewhere between 20 hours and 3 days. That means half of your drug is still in your body, several days later. So their whole personality changed. And of course they say, well, it's not a gateway drug. They all of them went to other drugs.
Mm-hmm.
And so that is my social experience with it,
that
it really took over the personalities. And
so
so I'm going to say that in my experience, it is an addictive drug. The FDA says it's an addictive drug, and it does change your personality. You become more, you lose your memory, short-term memory loss. You're apathetic. You don't have that, get up and go, and they can even have hallucinations. So, I am not for legalizing marijuana. You say, well, it's not as bad as alcohol. Alcohol its half-life is so short, you can't even measure it. You've got to keep drinking to stay high.
True.
So I'm not saying alcohol is good. I hardly ever drink personally, but I always say 2 wrongs don't make a right. If alcohol is bad and marijuana is bad, well, let's just add on heroin too, because that is not a good argument.
Okay.
Because 2 wrongs don't make a right. Let's just stay with alcohol. That's what's our vice. But I don't. So I'm not a proponent. I was one of the only people in California who voted against legalizing marijuana.
Me too. But go ahead now. Let Mark take the stage here and explain a little bit about it.
Well, I think I have, strong opinions as the doctor does, and I feel too. Anybody who says that marijuana is not a gateway drug is just wants to smoke marijuana, because or whatever reason they think any drug is a gateway drug. Any drink is a gateway drink. It's like whatever somebody goes to at the beginning is what they go to. But if they start getting to a point of dependency, like you were talking about in abuse, then they go to full-on addiction.
Yes.
That's the trajectory.
Okay.
So you start with whichever one was given to you. And now most of these kids can get, in middle school now, they can get cocaine and marijuana and all these other drugs much easier than alcohol. Wow. So they're starting to do drugs before alcohol. Now, back when we were younger, it was the different, it was the
alcohol first,
opposite.
Right?
Yes. And so, I believe it's a gateway drug. I know it's addictive. I know it does all the things the doctor was saying, your short-term memory, your focus, your apathy. Who knows what it does to the body? First off, the smoke and all of that, but who knows what it does to the brain and the body long-term? We really don't have those studies. And what is really frightening today is back when, doctor, when you talk about in the 60s and 70s and even 80s, there's different types of marijuana. You had, it was the Maui Wowie and skunk weed. Basically, it was either good or bad. And now there's so many different variants of marijuana where, a lot of them have fentanyl in it. Everything has fentanyl in it now.
So scary.
The, people are hallucinating left and right with these really high strains, with such a high strain of THC. They are hallucinating normally now. So the marijuana is so much stronger than it ever has been. And that's one thing that I think is very scary about it. I think a whole different topic is CBD. Okay. CBD, I think, for the health industry is going to be a godsend, in my opinion. But CBD, the THC is taken out of it. Right. So it has no type of effect on you, no type of euphoric effect whatsoever. I will say one thing, and I don't, the legalization of it, who cares? For me, 95,000 people died of alcohol-related deaths last year. 95,000 people.
I didn't know that the numbers were so high
last year alone. And THC, marijuana, is the second most abused drug. Right.
Oh, wow.
So now I was going to say earlier, doctor, this is a COVID thing. My COVID brain just kicked in. I had COVID and I have so many pieces of paper in front of me right now because I lose short-term memory. Like I'll be talking and then the thought just goes. So, so sorry about that. If I get off on tangents and I can't get back, it's definitely because of that. So that's what I wanted to say about that. Legal or not, alcohol is legal. We had almost 100,000 people die from a legal thing. So I don't care if it's legal or not. Right. It's still a drug, and you can still become addicted to it.
Correct.
And some people may be smoking on a Sunday once a month, maybe. Okay.
How do you know if you're addicted?
Well, I mean,
I'm asking for the audience because I know people that I'm sure are, but claim that they definitely are not. So I'm asking.
We used to say in alcoholism,
Mhm.
in medicine, we used to say if you take one drink every day and you have to take it. But that's not really physiologic addiction. But it's a psychological, I have to have my drink at night.
I
But
see.
that's what we used to say. But that's pretty strict. I mean,
Mm.
I'm not saying that you're bad if you do that. But when I was in training in medical school, that's what they had told us.
Mhm.
Yeah, and I think that's kind of and that I think has helped perpetuate a fallacy of what addiction is, because, you don't have to be an alcoholic. You don't have to drink every day. You can be an alcoholic and drink once every 6 months.
Oh, I did not know that.
Well, it depends on why you drink, how you drink, and what do you, someone who drinks just to have a couple of drinks. An alcoholic drinks for an effect. Whatever it may be for them, to escape their reality, to get out of themselves, or the pain, or the loneliness, or the sadness. There's a lot of, as the doctor was saying, there's two aspects here. One is physiologically and one is psychologically.
Right.
So there's two, when you're addicted to both.
I see.
So what happens in detox is, people are like, well, I went to a 10-day detox, and it's like, okay, now that's horrific, but that's the easy part. Now is the rest of your life. Right. And this is the hard part, because it's the psychological stuff. We never learned coping skills. We didn't have, that's why we drank. When I drank, it all of a sudden made me feel different. It made me feel okay. My social anxiety went away. I didn't even know what social anxiety meant, but I knew I could be around people and have fun. Right. And these things went away. Now I'm told I have to take away the thing that helps me function.
Right.
So what do I do? If you're not going to give me something, so now you have to learn the rest, and that's for the rest of your life. And I think there's 4 stages of addiction, and
you can tell us.
I actually put them in my notes.
Good.
Because I
want to tell us about that.
I mean, the first stage is experimentation, right? And that's usually when you're younger, and you're just like, somebody says, "Hey, there's this thing," and and you start going there, and that's just and usually people who don't have good self-esteem, whatever, peer pressure, we succumb to that. Some people don't, but a lot of us will do. And then sometimes it'll just end there. But if they have a propensity for addiction, maybe there's mental health issues, maybe there's other things going on, they can then start to get into more regular use and abuse. And that's the second stage, where it becomes more part of their life, you know, and it's like, they're the party guy or the party girl or whatever. They're still doing well. They're still, functioning, going to school, doing all their stuff. But, they're a party person. So that could be their moniker, and then after that.
Wait, hold on 1 second. Hold on. Yeah. Was that yours? Were you the party person in Beverly Hills High School?
No, I actually used to be Marc from Boston. How are you? So I was at my high school, sure. Yeah,
I went to Beverly. I did.
Yeah,
I went to Beverly. I was never a party person. My dad was also really strict with me. I was scared to death. I couldn't come home and be. There was no way.
So I was a nerdy girl.
Yeah, I was the nerd.
I fit all categories because that was part of my problem. I always felt alone in this world. I never felt like I belonged. So I played sports. So I was a jock. I did well in school. So I was a brain. Sometimes I hung out with the bad kids who were smoking. So I hung out with the bad kids, right? So I would assimilate to whatever group was around me, but I never felt I was part of any. Wow. And that was my biggest thing. My biggest thing for me was loneliness and sadness. That somehow I felt I was defective and different. I knew something was wrong with me, but I never knew what
it was.
And so I would read books. In high school, I would read The Power of Positive Thinking, The Power of Prayer, The Road Less Traveled, Sermon on the Mount. I'm a teenager. Why am I reading these books? Because I was in so much pain about why I was so different. And I didn't know until the day I woke up and I went, I'm an alcoholic. It just clicked. And I got sober 3 days later, and that was.
But you're very lucky that you woke up to that, because so many do not. Yes. Right? Is that the main problem? Is that the person doesn't want to admit it?
Well, there's a tiny percentage of people who get sober and stay sober, and there's a
very tiny
percentage of people who actually seek out help. And then there's the rest of the world, and there's so many people. And I
Mm-hmm.
think that's something you and I were discussing, that for me, I'm talking a little bit about my personal stuff here.
That's great.
Because I think the stigma needs to go.
I agree with
You
that.
know?
There's a big stigma on that.
And especially, I think with alcoholism and addiction, we're getting a little better, that we're not bad, defective misfits anymore. But now it seems to be with mental health. It's like if somebody has mental health issues, you know,
Right.
it's kind of, you keep that in the closet too.
Right.
And we have to take all this out of the closet.
Correct.
And you and I were even discussing earlier that people don't want to say, I have my son or my wife or somebody has a problem, because then it's like,
you feel like something's wrong with the family.
yeah, there's shame and guilt, and we have to handle it, but nobody knows how to handle it. Really. I mean, you know, you learn how to handle it.
How is a parent, I'm glad you brought that up, because there's an important question. How is a parent supposed to notice, or do they notice, because they're always the last to know, that their child all of a sudden became an addict, or is really taking drugs every day in order to be a straight A student? Or there's so many stories I've heard throughout the time.
Well, I think there's a lot of time-tested things we've heard over the years that are true. Really, I think one thing is to try to see your child as if it was somebody else's child, number one. So look at your child as a person, and not as your little child that could do no wrong. Or it's not even that they couldn't do any wrong, you just don't want them hurt.
Right.
So we sometimes get blinders because we just don't want to see that in our kid. You know, we don't want our kid in pain. And so I think to see, you know, your child as a person, and the things that really do start to happen. Do they start, you know, there's natural things, we grow, right? And when we start dressing differently and hanging out with different kids and doing these things naturally. But when you see them like so veer off of what they've been doing, like say they've been like, you know, track is my thing, and they run track, and all of a sudden one day it's like, I don't want to do track anymore. Well, there's probably something really behind that.
I see.
Whether it's addiction or alcoholism or mental health, something happened, right? So I think when you see these big upheavals and these big changes, and also, you know, I think when someone really starts to do drugs, you know, you talk about these personality shifts, and the doctor will know about this too, is that, you know, a lot of those personality shifts are when somebody's using a lot, there's a withdrawal. So if I'm drinking or doing drugs and I'm high, I'm like, I come in, you're like, oh my gosh, you know, we're having a great conversation. And then the next day I turn on you and I'm like, Mom, you're this and you're this and blah, 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 blah. Right. Well, I'm withdrawing. So now I'm getting irritable. Now I'm getting sick. Now I'm getting angry.
I think that's an excellent point. If you see exaggerated mood swings, now teenagers will have mood swings, but you can see the difference. And that's an excellent point, that if you see behavioral changes, this is not my kid anymore. Just like I saw in my roommates, they weren't the people I knew before. That's a big red flag.
I think so. Yeah. And I think, you know, like the doctor's saying, it really is. It really is. And I think, you know, and we want to believe our children. And I'll just tell you from my years dealing with alcoholics and drug addicts and people with mental health issues that, you know, a lot of times when they say, you know, I'm so sorry, I'll never do it again, I don't want to, they really mean it.
They mean it
in that moment.
But at 2 hours, when that's all gone, there's no capacity to not say no anymore.
I see.
Do you know what I mean? And so they mean it in that moment, but they'll be high by the end of the day. And these lovely, wonderful people that we see are the real people. That person you see 2 hours later doing whatever, stealing from your purse or whatever, is the disease, is the person that has something, you know, something to deal with.
And
you know,
I'm sorry.
Go on, you know, I've got 5 kids, and they're all different. But one thing I tried to do is get involved with their friends and know who their friends are. And be involved in their life. Now teenagers want to isolate themselves in their own group. But I used to have them come over for parties here, or get involved with I hated paintball. I hated getting shot by the stupid paintballs, and I'd do the paintball with them.
Right.
But I think that, and I was the coach, and I would, even when in high school, I'd go watch their practices, see who they hang out with, and if you see a big change, you've got to investigate. And but I really liked what you said. You know, seeing changes This is not my kid anymore. You've got to find out what's going on.
What's going on. Also, you touched on something very important earlier that you said that even in, maybe if I'm wrong, correct me, even in marijuana today, they're putting fentanyl.
Yes.
That's very scary because I personally know through this pandemic, 4 people that OD'd on fentanyl.
People are ODing on fentanyl every day.
Yes.
There's something, fentanyl, and the doctor knows this, of course. Fentanyl, you can put a little droplets of fentanyl and people have this huge effect. The high is so huge. So what they're doing is they're putting it in everything so it's cheaper for them. If they put a little fentanyl in and then they can cut the cocaine, then all of a sudden they can sell more. Right. And so that's what's happening. They're putting fentanyl, because I have clients come in all the time and we do a baseline, drug test, a urinalysis when they come in, and I'll be like, okay, you didn't mention fentanyl in your pre-assessment. And they're like, well, I've never done fentanyl. I'm like, well,
it's coming up.
It's here now.
Right.
And they, so many people don't even know they're doing it. So, and it's so dangerous because, you can OD and die the first time. It's just, it just will shut you down, shut your respiratory, your whole system down. The doctor could probably speak more.
Yeah, well, a lot of those drugs have idiosyncratic reactions. So out of nowhere, you stop breathing. Okay. Yeah. And Valium is a drug like that. When I was when I was an intern, I did orthopedic surgery rotation, and I gave IV Valium, and I gave the smallest amount. And this patient had what idiosyncratic means, just a strange reaction. Stop breathing.
Wow.
And I'm way down the ward at the county hospital. I'm screaming for a nurse. I need an ambu bag. I gave 2.5 milligrams and he stops breathing, a full-grown man. So my point is that these drugs are not to play with. They can have reactions on some people which you don't expect. And it's very hard to know. And also the doses they're giving, these aren't pharmaceutical companies regulating the doses.
Right.
Yes.
Who knows what the hell doses is in that marijuana? I mean, it's dangerous stuff. And I think in your own family, you just got to make sure we educate the kids young that it's not an option. The other thing I just wanted to touch on was alcoholism. A lot of people don't realize. Yeah, go ahead.
Doctor, can I just, before we move on from that, I just wanted to talk about
and you
that.
Also guys have a few more minutes. I'm just letting you know, about 10 minutes. Yes.
I just wanted to talk about that too with the parents. I think it was very good what you said about, getting involved in your children's lives and all of that. And I think, in life, what most of us really want is to be heard. Yes. We don't need to be right or even get what we're asking for. We just want to know someone hears us. So I think when you talk to your children, is like, you don't preach to them and this is evil and this is wrong. It's more about talking about what it does and let them know, have them talk to you about it. And I think you always need that safety. If you are high or something is going wrong, you need to call me and there will be no repercussions for that. Right. I mean, I know we all say it's very hard, but we have to do it because our kids. I was just going to say it's very hard to actually do. Well, it's harder to go to their funeral. Yeah, right. It really is because that's what's happening. That's really got me. Yes, I'll go. Opioids. Only opioids last year, 85,000. Only alcohol, 95,000. That's 180,000. Probably 20 to 30-year-olds died last year.
Percentage-wise, that's huge for opioids. That's crazy. 85,000, doctor. Crazy. Vietnam War, 57,000 men and women died. Right. Wow. 50,000 Americans died. 85 died just last year on opioids. That's crazy. 180 alcohol and opiates combined. For me, I look at it. I did some numbers right here. Okay. There's 7,100 deaths a month on opioids. Wow. Right. 9/11, 2,977 Americans were killed. Right. Yeah. So the two 9/11s every month. Yeah. And nobody talks about it. No one's talking about it. But we talk about it. We give it lip service, but no one's doing anything. No, nothing. In the Afghanistan war, in the 20 years of this war, 2,312 people have died. Wow. Wow. 180,000 on drugs and alcohol last year. And that's not even all the other overdoses. Right. I'm talking about just opioids and alcohol. It's a huge problem. It's a huge problem. And a lot of it is changing the culture. It's not cool to be a gang member. It's not cool to be a druggie. And I think that we have to be I don't know how we exact do it, but humans are herd mentality, and really have to change the culture that it's not cool and it's not okay.
Yeah.
One thing, when I was at Harbor General as an intern, I went to BU, Boston University, at Boston Children's Hospital.
Nice.
And I took care of a lot of alcohol withdrawal patients. And I just wanted to say that it can be a physical dependency. And you cannot stop them cold turkey. They go into seizures. They die. I took care of them.
I didn't realize that.
Yes, most people don't realize
Very dangerous.
So it's the physical addiction so severe that you're right. People can die from it, and so we admit them to the hospital. We put them on a sedative, monitor them IV, keep them going with hydration. But it is a dangerous thing to withdraw. It is physical. So
alcohol and benzodiazepines are the two worst. That's where on a detox, those are the two worst where most people will die.
Oh, wow.
Yeah. So, I'm subacute detox, which has some medical, but we're always monitoring, and then we send them directly to the hospital
if they need it.
If they need it.
I was taking care of the really bad ones, and it's nothing to play around with. So this detox thing, it's not like, okay, I'm going to stop today. They can't stop.
Yeah. If you say you had a loved one who's like, say, 50 and they've been drinking for 20 years, you don't want them to stop until the day they get there.
Okay.
Because they could die in your home, like the doctor's saying. I think that's a huge point.
Yeah.
There's one thing, just to go way back when we talk about marijuana, the only thing that, one thing I see with marijuana that I see as a good thing is that I think it can show a lot of people, younger people especially, say it's my medicine. It keeps me right. It keeps me straight.
I've heard that, yes.
And I'll tell you, I've seen it. I've seen it's, people call it harm reduction. Well, at least they're not doing harder drugs and they're only smoking marijuana. Okay, I do understand that, and that's great. But what I see is if someone's smoking marijuana, and it does affect them in some positive ways, where they're not so erratic and they're not violent and they're not doing these things, that points to that you might have a mental health issue where another medication could help you.
But more so.
So let's find the right medication.
I see.
But what they're doing is self-prescribing. It's easier.
Right.
And they're
terrific. That is a terrific point. I know patients and people who use marijuana because they're very high strung, and it is a way for them to stay what I call level.
Yeah.
And the better, maybe it would be marijuana, but they probably should be under a psychiatrist or some sort of healthcare professional to figure out what's going on here. And maybe it is marijuana. I don't have I don't have a beef with using marijuana under the supervision of a physician. In fact, you don't have to smoke it. You could take a pill.
You can, whatever they're handy today.
I don't have a problem with that. My problem is with recreational marijuana. Why don't we do recreational Valium?
Yes. You're right. Exactly.
So guys, this went by really fast because there's so much to talk about. So I don't think we're done here. I think you're going to have to revisit us, and we're going to have to get much deeper into this subject because it's such a huge subject. And I wanted to even get into the point of every other house could have someone that's an addict in it, and it could be a completely quote unquote regular home. It doesn't have to be from a bad environment or something like that. And I was going to talk more about things like that as well, so people would be more aware.
I think that's huge. And just very quickly, because it's in every home.
That's what I wanted to know.
I deal with a lot of high-end people. I deal with politicians and celebrities and athletes, and I deal with gangbangers and kids from the streets, and I deal with them all. And there's no socioeconomic safety net here. And sometimes it's a lot harder for somebody who has means to get sober, because if you have nothing, you're pretty much, my life is awful.
Right.
If you can go to your apartment in New York City and your home in France, it might take a lot longer to get sober. And one thing I did want to say quickly before we go is that I wrote down here for myself to remember, and I put it in big red letters.
Okay.
I said that parents can become addicted to helping their children helping their children and forsaking their whole lives themselves. And I think it's a really important topic you want to bring up. And I think
that's a huge topic. So I want to invite you back so we can talk about specifically those things, because I don't think we're, like I said, we can't be finished here in such a short time on such a big subject and so many angles to it. That is huge because as a parent, you always feel like you need to help your child, and when they're an addict, you learn that you're supposed to do the exact opposite.
Well,
let them fall.
Most of the parents help, and I mean this in the
best way,
no disrespect, is actually hurting and killing their children. It really is.
Yes.
Most parents that I deal with, I have to educate them sometimes more than the kids.
Yes.
And the adults. They're these are I deal with adults, but they're all. A lot of them have a child's mentality.
Yes.
This has been a great program. I've really enjoyed it.
And we're going to continue with it. It's not over. We're going to definitely have you back and continue a little bit more. Thank you, Dr. Wright. I know you're a busy man.
I'm not that busy. What are you talking about?
I know.
Only a few surgeries a day.
I gotta hurry up and get to the beach before the sun goes down.
Okay. Good for you. Thank you, Marc, for being here and taking out of your time and coming here to us. Thank you to TLA. Thank you to Mad Medicine, our watchers, our viewers. Thank you very much, and have a great day, everyone. Bye.
See you.